Greetings, everyone. Welcome to the third class in this third semester of the Emerald Choral Academy. I am Gary Cannon, Artistic Director of the Emerald Ensemble, a professional choir based in Seattle. The Emerald Choral Academy is a series of interactive webinars during which our area's leading professional choristers reveal their personal tricks of the trade to community singers. These webinars are then made available freely to singers across the world via YouTube. This presentation is funded in part by a grant from the Washington State Arts Commission, in addition to the National Endowment for the Arts, For Culture, and the Seattle Office of Arts and Culture, as well as many generous donors. We encourage anyone participating or viewing this webinar to make a donation as you are able at emeraldensemble.org. You can also subscribe to our YouTube channel and join our mailing list to hear about future sessions of the Academy and the other activities of the Emerald Ensemble. In a moment, I'll place the links where you can find those various elements into the chat feature. This webinar is being recorded. By participating, you are granting the Emerald Ensemble permission to share your contribution. Your microphones and cameras will remain off for the duration of the presentation. You can, however, ask questions to the presenter by typing into the chat or the Q&A features at the bottom of your screen. Periodically, I'll interject to field your questions to our presenter. And today, our highly esteemed presenter is Scott Kovacs, one of the true rock stars in Seattle choral music. In addition to his role as executive director of the Emerald Ensemble, he is a solo singer, chorister, administrator, pedagogue, conductor, researcher, and composer. I think that I've pretty much covered all the bases there. And he's really one of the finest bass baritones, speaking of covering the bases in our region. Scott's topic today is semi-occluded vocal tract exercises. Thank you, Scott Kovacs.
Good morning, everybody. I was just looking at the participants list, and I think I know all of you either personally or peripherally, and it's just really great to share a topic that has become pretty hot in the vocal science field, and we've really developed a lot more of the science itself around semi-occluded vocal tract postures and the work of voice professionals using semi-occluded vocal tract exercises. My usual disclaimer: those of you that know me know that I always put this disclaimer up. All of the information in this presentation is intended to be informational. It is not intended for the purpose of diagnosing or treating medical disorders. The Emerald Choral Academy is not responsible for conditions that require a licensed professional for diagnosis or treatment. If you are experiencing symptoms that might require a diagnosis, seek medical attention. So, in particular, I know that some of the folks that are approaching SOVT and other kinds of therapeutic techniques in their voice work are either long haulers or are recovering from COVID. And so I just want to share with you that yes, the SOVT postures are very useful for folks that are experiencing symptoms of COVID, long haul symptoms, or recovery symptoms from COVID. But please do work with either an SLP, speech language pathologist, or an ENT to make sure that you have been medically discharged for work with a voice professional before you begin those therapies with them, those postures. So what is semi-occluded vocal tract exercise? What are they? They include, we refer to them as postures that involve partial closing of the mouth, narrowing of the vocal tract, or somehow increasing the intraoral air pressure inside the mouth, resulting in more efficient phonation. Easiest to describe those through examples, which are humming, lip trills, using voiced or unvoiced fricatives, st, f, z, z, t, v, v, straw phonation, bubble phonation, which we'll get into toward the end, and manual occlusion. And manual occlusion just means putting your hand over your mouth. This is an example of a semi-occluded vocal tract exercise, believe it or not. I'm just checking the chat to make sure okay. Oh, that's you, Gary. All right, I just want to make sure everyone can hear me all right. Okay, so let's get into it. A little bit more about the why. Why would we use semi-occluded vocal tract exercises? And I want to mention that my personal approach as a voice professional is I work mostly with choral singers. So I want you to I want to convey that my mindset is that of a chorister, even though these are all useful for any studio work that you might be doing. So for choral directors, making SOVTE part of your warm-up mechanism is a great way to introduce these concepts to your singers, and here's why. It will help develop more complete vocal fold adduction. Adduction is when the vocal folds come together when they meet. We have abduction, that's when they're apart, and adduction is when they're together. Breathy tone is sometimes attributed to less complete or not as the transverse arytnothyroid muscles are not giving complete compression on the vocal folds. So we can help encourage complete adduction and reducing that breathy tone. Legato singing. So if you discover that it's very hard, it helps encourage connection of the tone across the registration, across pitches. Registration events. So I should talk a little bit about registration events. Registration event is my preferred term for break and even passaggio. Registration events are those zones in your voice where you either go from your chest voice to your head voice, or the mix in between. The registration events are a pretty complex set of maneuvers performed in the larynx that require a balance between the cricothyroid and the arytnothyroid muscles as the cricothyroid or chest voice dominant sound passes off to the arytnothyroid or head voice muscles. So working with straw phonation or SOVTE is one way to improve that handoff between the CT and the AT sound, or the chest voice and the head voice. Some folks refer to that as mode 1 and mode 2. Pressed tone. If you have a very, very pressed tone, high subglottal air pressure with tight glottal mechanism, you know, when the glottis is that tight, or when the air pressure is that tight, you have to have very, very high glottal tension in order to control the airflow. So straw phonation is one way to help with that. Helps reduce fatigue, provides relaxation from enervation. It's like giving your voice a little massage. In fact, bubble phonation in particular has this backwards percussive effect that we can see through analysis, through visual analysis, audio analysis, that we're actually getting a slight percussive effect that helps reset tired and overworked muscles. So if you happen to be doing Belshazzar's Feast twice in a day, for say, and you really need to give yourself a cool off in between those two concerts, bubble phonation or straw phonation is a great way to give yourself relaxation. Those of you that are here today that are MMRers, Midsummer Musical Retreat, we all walk around with a straw, humming into a straw all day long to help relieve some of the vocal tension when you hit that sixth class at the end of the day after having rehearsed for 3 or 4 or 5 hours. It's a great warm up and cool down. Cool down is something that we don't talk about a lot as voice professionals, and we really should. After a rehearsal, particularly a strenuous rehearsal, it's a great idea to cool the voice back down. It's just like after you've taken a 3-mile run around Green Lake, and now you're going to walk that last 0.2 miles back to the car. It's just a way to help the mechanism come back down, so that the high tension of the vocal use that's added a lot of lactic acid to the intrinsic muscles gives you a way to keep processing the enzymes and proteins that have entered the vocal mechanism itself, the subsystems of the voice. Glottal efficiency. Glottal efficiency means a very efficient, or a good relationship between air pressure and subglottal air pressure and intraoral air pressure. That glottis is the glottal mechanism is similar. If you've got a hose, if you imagine that when you turn on the spigot on the hose, the water coming out is similar to the gases that support phonation, or that are converted into phonation by the vocal folds. The glottal efficiency is like sticking your thumb on the end of the hose, right? That's the glottal mechanism, and you can increase the pressure of the water coming out, or you can decrease it, or you can change the amount of volume you can change the volume at the spigot. But the amount of efficiency, like, can you get the soap off your car? If you want to increase the amount of pressure, you have to press down on your thumb, and that's the idea of glottal efficiency. Increased power with long-term use. We use semi-occluded vocal tract therapy in singers that are experiencing difficulty with vocal, what some people call power. In other words, the ability to create substantial volume. So those are all good reasons for the why. I don't have a watch in front of me, so Gary, you may have to flag me if I'm running behind.
You're absolutely fine.
Okay.
No worries.
Great. I mean, I'm 15 minutes in, it's only the first slide, so it must mean I'm talking a lot. Okay, science of SOVT. I'm going to actually, we can start here. Vocal fold alignment and squaring up. The differential in air pressure from subglottal, meaning below the glottis, below the vocal folds, as opposed to intraoral, is how phonation works. I just mentioned that. So gases leave the tank, your lungs, under pressure, and they escape through the windpipe, the trachea, and they, as the vocal folds are closed, pressure builds up underneath them, and the vocal folds then they actually flutter. They don't jiggle. They flutter as a result of the gases passing underneath them. So when you have negative air pressure up here and positive air pressure down here, there's a natural encouragement of the gases to escape past and create that flutter in the vocal folds, which then becomes acoustic energy. We're converting the gas to acoustic energy. When you occlude the vocal tract, either manually or with a straw or in some other way, you are increasing the intraoral air pressure, and you're returning some of that energy back to the vocal folds, making this process more efficient, meaning that the amount of strain or the amount of tension on the intrinsic muscles of the larynx is less. So you can actually have a more relaxed experience with phonation, which is why when we get into registration events, it's a little easier to study those and to experience them internally, because there's less tension on the vocal mechanism during those sometimes complicated events. When the air pressure is more equalized, and this is what I'm talking about, when the air pressure is more equalized, the cricothyroid and thyroretinoid muscles and other intrinsic systems can coordinate more efficiently, resulting in better reduction and more dynamic registration changes. So let me talk about dynamic registration changes. For those of us that have studied our passagios, our breaks for a long time, there are one of the reasons I don't like the term break per se is that it indicates that there's a point at which something suddenly just switches over. So if the voice is breaking at the registration event, we call that a static break or a static registration event. If you can glide efficiently from one registration area to the other, that would be an example of a dynamic registration event. And we really want dynamic registration events because they cause less fatigue on the voice and they give you more versatility and flexibility and reduce fatigue over the stretch of time of rehearsal or whatever you're working on. This is a little bit of what I'm talking about. So negative air pressure up here, positive air pressure down here. These are the vocal folds themselves. These are what we sometimes call the false folds. They are the ventricular folds. They create a little ventricle down here. And as you can see, the vocal folds themselves they're a little bit thick. And that's why we get this flapping sort of butterfly motion, wing motion out of those vocal folds. The mechanisms that have to square up in particular are here and here. We have the cricothyroid and the transarytenoid muscle systems in the, this is your hyoid bone, it's right here. And this particular set of muscles is what has to hand off during a registration change. And we want one set to just sort of pass itself off to the next set. And in particular, the idea that when we're going into head voice, we're increasing tension. So, and as we get higher, we need more air to produce the tone that we're requesting from our vocal folds. I promise I'm going to get to the good stuff. It's important to know a little bit about the science. So the principal concept behind the acoustic aspect, in other words, the sound of SOVT, is called vocal tract inertance. Sometimes we call it back pressure. So I'm creating back pressure. And notice that there's no sound coming out of my nose. That's coming out my nose. That's not. That's creating true vocal tract inertance. So what's happening is that both air energy, both the physical gas movement and the acoustic energy, the sound waves themselves, are being trapped in the mouth. So energy is being taken back toward the vocal mechanism and increasing efficiency at the glottal level. Balance between subglottal and supraglottal air pressure is also, which I just demonstrated, is part of vocal tract inertance. Sometimes we refer to it as intraoral air pressure. Intraoral just means inside the mouth. Supraglottal refers to specifically above the vocal folds. Lengthening the vocal tract, as with a straw, further balances the mechanism and increases vocal tract inertance, making phonation more efficient. So, if you think about it, your vocal tract is in a few very basic sections. You have the wind, everything that's subglottal from here to here is about that long. And everything from here to here, this is Frank the pharynx, from about here to here is not quite that long, but you've got probably, if this is 10 inches, you've got maybe 5 to 6 inches here. When you add a straw, you're increasing the overall length of the vocal tract, helping to equalize the air pressure above and below the vocal folds. And thank you to our friends at Voice Science Works for a lot of this sort of help in defining these terms. If you don't know about the Voice Science Works website, it's a great resource for professionals and amateurs alike, amateur singers alike. This is, of course, I had a great diagram here to explain how this works. So we have pressure from the lungs coming up, and vocal tract inertance creates back pressure at the lips, and we get a more efficient and easy time of phonation at the vocal fold level. We're going to practice this in just a little bit. I'll demonstrate it. So when we're not using a straw or other appliance, and when I say appliance, I have my desk is covered with examples of appliances that we can use for semi-occluded vocal tract exercises. We call all of them postures. They're not. Exercise is really sort of a recent addition to the acronym, but they're really referred to in literature as a posture. I've used IPA symbols here, and I've tried to explain them, but I see I missed one here. Humming is the probably most common example of a semi-occluded vocal exercise. You can use an M, N, or an NG. Those are all examples of hum. I'm going to borrow my last note here, which says internal vowel. When we're saying an M, when we're singing or saying an M or an N in particular, it's important to think about an internal vowel, more so with the M than with the N. With the M, I'm practicing an oo. That's an E. That's an ah. And having an internal vowel is an important part of practicing or taking advantage of that vocal tract inertance to develop resonance, mask resonance. If we move from one of these voiced consonants to a vowel, and I'm speaking to choral conductors, particularly in the room right now, it's important to choose a vowel whose formant is going to be close to the placement of the voiced consonant. So, for example, if we're doing me, the E formant is very close, is relatively close, closer to the lips. If we choose an N, na, or nay, again, we're choosing a formant that feels like where the consonant is placed in the mouth. They're near each other. Hung, ah, because the ah formant is further back in the mouth. It just creates efficiency in the exercise. That's not to say that you can't do hung yi. It's a great way to practice changing focus from the backwards placement, from the retrovelar placement of that agma, of the to a forward vowel. Lip trills and tongue trills are great SOVTEs. Now, for those of us that struggle with lip trills, there's a hack, and I'm going to credit my friend Rebecca Gilmore, who's teaching next week or next month, and it's this. Some of us really struggle with lip trills, and if you just put one finger gently on each side of the mouth and hold lightly, it can really activate that experience. Tongue trills, raspberries, are another great SOVTE. Now, to move on to the use of fricatives or voice consonants, unvoiced consonants to voice consonants. This is one that I use in my studio frequently. You know, I can do I do a breath warm up on s, t, s, t, ch, ch, ch. But if we take s, sh, f, and th, and we turn them into s, or sh, or f, or those are great ways to teach onset, because by using that unvoiced consonant, we're encouraging airflow. Air will begin before the onset of pitch. There's a little bit of resistance in the mouth, so we get efficient use of the vocal folds at onset, and we're teaching just a little bit of that front lip resonance in creating those voiced consonants. It's also a great way to remind people that voiced consonants are pitched, and to really practice pitch on voiced consonants. If you have a lot of scooping at voiced consonants, for example, v, 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 or z, it's a great way to get folks to focus on really coming into the middle of the pitch. on those voiced consonants at the beginnings of words. Hand over mouth is another one that works really well, and you can even just use your hand to shade the pitch. Ooh, ooh, ooh. That does help get some of the energy back, but that's more acoustic energy than to the mask. But you can It's a little easier to practice internal vowels that way if you have your hand over your mouth. Moving on to straw phonation. So we should first of all talk about the father of this science of straw phonation, Dr. Ingo Tietze, who teaches at the University of Utah. He's responsible for one of the best vocology programs in the world. If you have a voice teacher who's a vocalogist, or really any voice professional, they've read this book and probably taken one or two of his classes. He's the father of modern straw phonation, and there's an entire chapter in there on the physics and acoustics of straw phonation. So the first thing we should talk about are the straws themselves. So I keep a jar of multiple sizes available, and by size I mean diameter, right? The diameter of the straw. I have a number here. So the wider the diameter of the straw, the lower resistance you're going to get. I keep a handy tool for cleaning them out at the sink. I recycle them all. I even run them through the dishwasher. So I do my best to not add plastic pollutants to the environment. The science says that the length of the straw is not important, that you can cut these in half and get just as useful an effect from a half-length straw doing straw phonation as you can from a full length. I leave mine at full length because I almost always use the same straw for bubble phonation as I do for regular straw phonation, and it's also a little bit easier to manipulate them. You can get a better angle with them being full length. Bendy straws. Yes, you can use a bendy straw for straw phonation. It's perfectly legit. There are people who talk about that the bend in the straw creates some sort of weird turbulence, back turbulence that can't be. If there is, it's probably so microscopic that it doesn't matter. So nothing in any of the literature says that you can't use a bendy straw to do your straw phonation. So fear not with that. I'm going to choose my orange straw. My orange straw is about the same diameter as a soda straw from McDonald's or your fast food store. Starbucks straws work particularly well. Particularly the old school plastic ones work really, really well. So Ingo Tietze talks about the stretch and unpress that comes with straw phonation, and what he really means is it's a great way to warm up, to relax the vocal fold, the vocal mechanism into functioning efficiently. We can do glides and slides. Or sirens. And I like to work generally high to low. For me, from my falsetto, and to work those registration events. So moving from chest voice to head voice, and I can even stay in the mix a little bit more easily, especially at whatever hour of the morning we're at, with a little bit of congestion. I was entirely in my mixed voice at that point. It's also, you can just hum a tune. And that was an example of the encouragement of legato singing that Tietze was taught, that I mentioned earlier, that Tietze talks about. It really gives the voice a way to move easily and efficiently from pitch to pitch without that the sense that the vocal mechanism is resetting for each individual change in pitch. It's also very useful for working on problem areas in your music. So if you are a bass baritone and you have to sing a lot of C's and D's and E's for a particular line, it gives a way to work on those places that might be problematic and in the music without over fatiguing yourself. Sitting at the piano, singing those high pitches repeatedly, it really will help increase. And I do recommend, by the way, choosing the vowels that you were going to sing. So I was singing Freude schöne Götter funken inside the straw. I was using those vowels as I was phonating through the straw. All right, moving along. I got a yay from Gary for quoting about Belshazzar's feast. Now, the fun stuff. Okay, if any of you have taken a voice lesson with me, if you have been in one of my classes at MMR, if you have been in one of my classes here at the Emerald Choral Academy, you have seen me, heard me talk about bubble phonation. And if you were ever a 6-year-old blowing bubbles in your milk, this is for you. So, what is bubble phonation? Well, basically you stick a straw in water and you phonate through the straw. So I'm going to take, I'm going to start with, let's do orange straw. It's a little easier to see on screen. And what I have here, this is actually, I don't know if Rick Como's in the room right now, but Rick, this is the one you sent me, and I'm doing this for a reason because I want to show everybody the device you made. But this is a mason jar, little ball jar, a canning jar. I also recommend if you get your creamer in the bottle, in a glass bottle, those bottles work really well too. I'm going to take a straw. I'm going to put it in the water, and generally for male voices you want 1 inch to 1.5 inches. Generally for female identifying voices you want between 1 inch and 3/4 inch. But you're going to have to find the place where it's most comfortable for you. So I'm going to put about 1 inch to 1.5 inches in here. I'm holding it like so, and I'm going to show you more devices in a minute to help. Start with a low-pitched hum. That feels pretty good. It's just about the right amount of pressure for me to be able to phonate easily. I'm not really pressing into the water in order to make bubbles. I'm noticing for myself, for one, that the bubbles start at the same time as the pitch. If the pitch starts without the bubbles, that means I'm going through my nose, that the pitch is going through my nose, that the acoustic energy is going through my nose, not through the straw. Physics, physiology, and psychology. That's pretty much everything we have for singing, right? I'm also picking, you can adjust, you can make it deeper. You get less acoustic energy that way. If it sounds softer, that means you're getting less acoustic energy. If it's not as deep, there's less pressure, there's less back pressure. So there's more acoustic energy leaving through the bubbles. Same thing, have a vowel inside. E, U, is a good one for bubble phonation in general. Same ideas. You can do glides, slides, and songs. And it's great for working your registration areas. And it's also useful for rehearsing your music. We'll go with Ode Joy. Freude schöner Götterfunken. Now, the great thing about bubble phonation is that you really can use anything to do bubble phonation with. I have one student that uses a Starbucks glass. You can use a regular glass. I do recommend keeping the water shallow enough so that you don't get a lot of overspray when you're working at your favorite piano or your keyboard. There are some other devices available commercially. This one is not a bong. It is called a Dr. Vox. All my students look at it and go, "What are you doing with that?" It is in fact a Dr. Vox. It's produced. They're made in Turkey, and this is the input and this is the output. And there's a straw that has graded centimeter marks on it, so that you can have exactly the amount of water pressure that you want. There's a little window that runs along the back, so that you can see how much water you have in it. And you can use more or less. There are other companies that produce these that actually use glass and scientific glass with gradations in it for therapeutic use if you're working with a voice, an SLP or an ENT. I want to just highlight and thank Rick Como, one of my MMR folks, one of my Midsummer Musical Retreat folks, who created this at home for himself. He actually, try not to drop this, he created this on his 3D printer at home, and he made a specialized disc that he can control the airflow through with his fingers on top, and got a commercially available silicone straw that can be easily washed. And we just put the lid on it like that, and it's great. I love that Rick made a homemade SOVTE bubble phonation appliance. I tried to get here in time, but they did not. One of the things that Kari Reagan talks about in her book, and for those of you that don't know, Kari Reagan is probably the top voice researcher, especially in vocal health, vocal trauma in our region. And Kari Reagan's book, A Systematic Approach to Voice, is probably one of the best textbooks for studio voice instruction that has come out in recent years. And she really does do a great job of giving people a practical approach to methodologies, including SOVT and SOVTE. And one of the things she demonstrates in her book is one of these little, it's a pipe with a ball. And this particular one that I got in does not do it well, but you can practice phonation this way. It's another example of using an appliance for semi-occluded vocal tract exercise work. Let's see here. I want to just mention that there's a few precautions, and I'm going to sort of circle back to the very beginning of the presentation. Don't sing on damaged or swollen vocal cords. If you are recovering from even a simple cold or an allergy attack or the flu or COVID, I really recommend that you wait until until you feel no more pain, at a minimum, that there's no more vocal fatigue, no more pain. And I always describe vocal pain in two ways to my studio. One, there's the dull ache of fatigue, right? You just did a 5-hour rehearsal with an orchestra and you're tired. Give your voice some rest. Sharp pain is the other kind. If you ever experience sharp pain in your vocal mechanism, definitely seek medical attention for that with either an ENT or some other voice professional. If you experience if you're experiencing pain in your voice or fatigue in your voice or voice changes for more than 10 days, you should seek help from an ENT or some other voice professional. The idea here is that if you are recovering from COVID or some other serious illness that has affected your phonation, you should be absolutely sure that there's no damage along the vocal folds before you begin returning to singing. The bubble phonation method is probably the gentlest and surest of the methods to help rebuild, and I use it as a therapeutic approach with all of my students that have had some sort of change to the voice and are looking to refamiliarize themselves with both phonation and with the amount of air energy that it takes to phonate fully and correctly. Voice professionals work together. Oftentimes, an ENT will hand off to an SLP, and the SLP will say, okay, now go back and get voice lessons. So often I'm the third person, and sometimes I'm the first person because I send that person to the ENT or the SLP. But we generally think about the idea that voice professionals are working together, and we certainly have Kari Reagan at University of Washington to thank for really promulgating that, that sort of circular relationship between voice professionals. If you are rebuilding your voice after an illness such as COVID, work slowly and breathe often. Do not hesitate to accommodate yourself with the need for more frequent breaths as you are recovering your voice. It is always a good idea to seek help from a voice professional when you are doing that kind of work, and that can be any of a number of wonderful people here in the area. If it's not me, there are many others that can assist you. I think that is, oh yeah, I just want to give a shout out to some of the sources that I use. Certainly Kari Reagan, Systematic Approach to Voice, the Artist Studio application. Our friend Ingo Tietze. This is a really thick and heavy read. There's a lot of physics in it. If you're into the physics of the voice, there's a lot there. Anatomy of the Voice by Theo Demon. This is a great illustrative book. And Voice Science Works, their website I mentioned, and I should probably give a shout out to one of my great gurus, Heidi Moss Erickson at the San Francisco Conservatory of Music, who is doing a lot in the work of studying the human voice and neurology, and the neurology of singing and the neurobiology of singing. So with that, I think I will stop and take questions. I have some other nerdy diagrams ready for folks that are references for folks that are interested in that. And I think I might have to close my blinds. Excuse me for just a second. I'm all striped.
The joys of this, the quarantine era, that you have to pay attention to things like window blinds and casual.
Well, given the weather we're expecting, I wasn't really planning on seeing a whole lot of sunshine this morning, so I left the blinds open, and you could tell. So
we don't have any questions in the Q&A or in the chat at this point, and this was so wonderful, densely informative that I don't have any either, and this is a first for an Emerald Choral Academy.
Wow. Yeah,
it's fascinating. Although perhaps the question for everybody else, whether anyone else was sitting out there in your respective homes, saying, along with Scott.
For any of you that are interested, there is a bubble phonation. If you just go to YouTube and search Scott Kovacs. There is a bubble phonation video that I've created on YouTube. It's geared more for low voices, but the principles apply to upper voices as well. I don't know if I have the link handy. Hang on, Gary. I think I'm all set up for a different YouTube.
I'm tracking that down. Okay. Now I said.
Yeah, absolutely, Kathleen. Happy to. So for male voices, for male identifying or low voices, if you are a contralto singing, baritone in a barbershop group, for example, you might want to use between 1 and 1.5 inches for low voice for generally for male identifying voices, and then for female identifying voices, I would recommend 1 to 3/4 of an inch. It's very, very slight. The difference is very, very, very slight. And Gary disappeared. Oh, there
Well,
it is.
that was intentional. So you're talking about 1.5 inches of the straw being inserted in the water, not the straw being 1.5 inches away from the bottom of the water. That's correct?
Yeah, let me see if I can, let me see if I can get a good image here with, I'll use a darker straw so maybe you can see. All right, so.
That one's creating some reflections. Do you have a solid color? That might work. That orange one was nice and clear. Yeah.
How about that? Okay, how about that? All right, so you do not want the straw touching the bottom of the glass, right? You want that cushion underneath to help provide some of the liquescent resistance that's necessary. So this is about 1 inch and maybe a little bit more. And that's a little too light for my voice. So I'm going to go a little bit deeper, probably about 1.5 inches. And that feels about right. That's the right amount of resistance for me. And I mean, physiologically, male identifying voices are different than in that there's just the tissue is thicker. Now, with the aging voice, if there are age-related changes to the voice, that may change a little bit. But those are generalizations. So if there are age-related changes to the voice, it may be one way or the other for you. So I would always suggest playing with it, that first set of 3 low hums, right, is a great way to test how much you need.
How would somebody go about discovering that sweet spot on their own? What does it feel like, or what other evidence?
My mantra in the studio is that good singing means that it's efficient, and efficiency in the body just feels right. It's not too much effort, and it gives you a little bit of pleasure back. So if you are noticing when you're doing your bubble phonation that you've got a good balance between the amount of energy that you're putting out versus the amount that you're getting back into your head, that's sort of helping with resonance and that acoustic inertance, it feels good. You actually get a little bit of dopamine and oxytocin in that process. You know, when we talk about muscle memory and the innervation process, you know, sometimes in studio work, when someone sings something really well, I'll like, let's take a snapshot of that. Let's rehearse it again and take a snapshot of it. We're allowing the relationship of oxytocin, dopamine, and serotonin to give the neural pathways, the neurobiology of singing, the opportunity to remember that we got a little boost of the good juices while we were singing when we did that. And it helps with recall. It creates efficiency in the neural pathways, in other words. And you had one, hang on.
Yeah, so her question is about rehearsing bubble phonation in a group or in a choir. Are there any COVID-related concerns with that? Spreading more air?
They're the same if you would be using wind instruments in rehearsal. So, for example, you know, I use the Dr. Vox mechanism, but even with the Dr. Vox mechanism, you're still running the risk of particles of
whatever's in your mouth,
viral particles escaping through the bubbles. So,
can you recommend any kind of then covering for that tip? I mean, other than putting a full face mask in front of it, are there? Knowing that you're not giving medical advice. Right?
So yeah, I'm not giving medical advice. So for example, here's the one that Rick Como made for me, and it's got the 3 holes across the top. You could theoretically put I don't have a mask filter handy. Darn it. You could theoretically put a mask filter, a nano filter over the openings, or you could put a mask filter over the opening here as a way to, but keeping in mind, if you put anything that you put on top or cover is going to increase the air pressure inside the appliance, so you're going to have to make adjustments to the depth of the straw. But I think you could easily adapt something to make sure that whatever appliance you're using, even if it's just a straw, you know, I don't know what you could use. I mean, the first thing that comes to mind is a wad of cotton, but you know that's going to come out the minute you put air pressure into the straw. So it's just, you know, if you have to I don't know the answer to that. It's a good question, though, Anne.
Yeah, the science of voice is not caught up to the science of COVID.
Or the science of
Work
SOVTE in the time of
specifically,
COVID, for that
right.
matter. Yeah.
One other wonderful question is how, in all of these things, not just bubble phonation, how they relate to the concept of vibrato.
Oh, wow. That is a very cogent question. If you know the answer, you can tell me, because we know so little about vibrato. We know so little about it in terms of the evolutionary, where it fits into the evolution of the human voice. Some scientists believe that vibrato is the product of a protective mechanism, including the ability to protect the voice when it's being shouted or used loudly. To, hey, there's a dinosaur over there, there's a mammoth, run, the saber-toothed tiger, as a protective mechanism that could go back that far. Others are more convinced that that it is simply a wonderful effect that comes from the sympathetic relationship between the muscles and the nerves of the mechanism. I will tell you this, that if you have a voice student, or if you are a person that experiences a lot of vocal tension because you've been taught to sing straight tone your entire life, and you've never been given the opportunity to explore warming the tone, that bubble phonation is a great way to relax the vocal mechanism and encourage encourage development of a safe and useful vibrato. Keeping in mind that straight tone is you are literally constraining the glottal mechanism to stay in place when you are singing straight tone, right? And that works well until we're about a certain age. And then oftentimes that becomes harder and harder, depending on the voice type.
So you're saying that the straight tone is in some respect the diminishment of that flow you're talking about.
And not only the flow, but the natural vibration of the muscles and the nerves around the intrinsic mechanism itself. Heidi Moss Erickson at San Francisco Conservatory believes that vibrato is necessary to protect a voice under high subglottal air pressure. It's a necessary.
As I've always heard, the vibrato is in a certain sense potentially a sign of the relaxation of the vocal cords.
Yeah. When I'm working in studio with a singer that discovers their vibrato, it's a great moment of celebration, because that means that the instrument is completely relaxed in those places and can move freely and freely with the tone. In other words, you're getting sort of a natural, it's a very natural response. Vibrato is a very, very natural thing. I don't know what else to say. If you are having, now let me talk about the opposite, because I think this might be more the root of the question. If you are having a problem with oscillation in the tone, right? That's different, and I'm going to call it oscillation, because there are any number of there's tremolo, there's vibrato, there's a whole host of different ways to talk about that oscillation in the voice. Some of them can be age-related changes. Some of them can be, some of them need attention from a voice professional in a studio. Others might need attention from a medical professional in an ENT's office. So all of those have different implications. Again, we don't know much about vibrato, so we make assumptions, and we have some scientific evidence about how it works, but we don't know why. Not really the answer that person was looking for, I think. Oh, Margaret.
I felt so to me, yeah. So how do you use, I'm going to rephrase the question that's there. How do you use SOVTEs to manage the amount of air you have? And I would add to that, how does it teach you mentally to train yourself in your mind to know how much air is an ideal amount of air to
use? It is a completely wonderful and magical thing that it is so efficient in the way it teaches breath and tone, right? We really like methods that create a synthesized environment. And I don't mean artificial, I mean that integrative. Let's use the word integrative. So we're integrating tone production with breath. Some people call it conservation of air, and I think that might be a bit of a misnomer. I think that we don't want to conserve too much air. We want to get as much air out as we can to create the tone that we need. So what's happening is, I think, a lot with SOVT, and there's a paper by, what's the dude's name? What's the guy's name? Marco Guzman. It's called Semi-Occluded Vocal Tract Exercises, a Physiologic Approach for Voice Training and Therapy. It's out of a Finnish university. That really delves into the neurological relationship of how this kind of training works. And basically, it feels good, so we remember how to do it. That's the bottom line. SOVTE, particularly bubble phonation, it feels good. And when something feels good, we tend to remember how to do it. That is a terrible explanation to a great question.
I think it's a fine explanation. I mean, even just knowing that that's the variable in play, that there isn't necessarily an external verification for knowing how you're regulating the airflow, that a lot of it is extrasensory.
You have to do it as a practice. I have one student who has been experiencing age-related changes to the voice, male student in his mid-70s, who does bubble phonation every day and has gained probably a third of his range back, as well as really developed a nice core pitch. You know, there might still be some age-related oscillation in the tone, but that for whom there is a clear pitch all the way through when he phonates. So, but he does his bubble phonation every single day.
Like piano practice,
yeah,
or
like practicing your piano.
Or jogging if you want to do a half marathon or things like that.
Yeah, yep.
Well, thank you, Scott. This has been. I wanted to ask one other. Well, no, I already said that. This is an incredibly informative presentation. One of those that I feel like there's so much information in here. It'll take 4 or 5 re-watchings in order to understand it. So thank you for that. Thank you also to all of our participants for your questions and your contributions. The next offering of the Emerald Choral Academy will take place on Saturday, November 20th, when Rebecca Gilmore will discuss hitting the high notes. And if you've ever heard Rebecca, the soprano, sing, you know she is exactly the right person to talk about that topic. Rebecca's presentation will partly be a masterclass with 1 or 2 of her students so that you can see her advice in practical applications. And if you've ever thought, wow, that note is hard, it's so high, then that's why we're doing this presentation just for you. We at the Emerald Ensemble are grateful for the enthusiasm of you, our audiences and supporters. As the Emerald Choral Academy continues, you can help support these efforts by donating at emeraldensemble.org. And you can also let us know of topics that you would like to see discussed in the future. In the meantime, I'm Gary Cannon. On behalf of Scott and all of the Emerald Academy, or Emerald Ensemble, I wish you good physical, mental, and musical health.